They refute him in part with a statement from a Canadian investigator,
yes,
who maintains that, now let's see if I can get this right, that for-profit, not for-profit, private operations in Canada, so that's not for profit, but private, and that's the phrase that they always use, in Canada are not the same as not-for-profit private in the United States. That in fact, the equivalency in the United States would be their public operations, their public clinics, and so on. Do you buy that one?
No, I don't. I mean, this has been, what's interesting is he's dismissing, or the report dismisses the world eminent expert in comparing the performance of for-profit healthcare. Editor Emeritus of the New England Journal of Medicine. I mean, this is the authority on peer-reviewed literature. Dismisses his conclusions. And what is Senator Kirby's evidence? It's a draft paper, not been made public, by a professor from Guelph. You're going to weigh those two as being equal? I mean, clearly, he's dismissing it based on opinion, not based on published evidence. This paper's not published. It probably couldn't get published in peer review because you have to have a rigorous methodology. This paper that that we're referring to, that Dr. Relman also agrees with, has been subject to strict peer review, or it would never have been published. Mm-hmm. So its methodology is airtight, and it does not stand up to the criticism that Senator Kirby's professor is leveling at it. There's no doubt, for example, let's take dialysis clinics in the United States, a 30% higher death rate. What you don't know about a for-profit delivery system can kill you. That's why we're quite insistent that that's a major flaw. We call it the big lie, that for-profit healthcare ownership doesn't matter. It's a matter of life and death. It matters an awful lot. What you don't know about for-profit healthcare, if you don't know how often they're changing the filters on their dialysis machine and you're judging just the quality of their carpets in their waiting room, you can get misled into thinking it's really slick and really high-tech.
And really safe.
And really safe. But the point is, to get a return on investment, they're cutting back on the number of professionals in the system, and that's affecting the quality of care. It stands to reason that you can't have a return on investment and not cut back on labor and on the quality.
We've got less than a minute left, but I want to ask you this finally. Do you have any concerns about the timing of the release of this report and others of this series?
Yes. The Kirby Committee, first of all, who appointed the Kirby Committee? It's an unelected committee, self-appointed, out there undermining the Royal Commissioner appointed by the Prime Minister. Clearly, this committee, and according to their own original timetable, should have been wrapped up more than a year ago. Senator Kirby has been tactically delaying his reports to try to undermine and sabotage the Royal Commission. He's also been going around meeting with right-wing premiers and health ministers in provinces that are trying to privatize. That's clearly a negative leadership role against the public interest. And that's why he's such a target. He's not an innocent bystander in this.
He'll be in a couple of minutes. We'll put all these things to him. Thanks a lot, Mike.
Thank you. All
Well, we have heard criticism of the Senate's report on the state of Canada's healthcare system from the Canadian Health Coalition and just a few moments ago, but now we talk to the man who is the chair of that Senate committee, whose name is attached to that report. Senator Michael Kirby joins me.
Delighted to be with you. Glad to be here.
Let's start with the question about the one that revolves around you and the issue of conflict of interest. Michael McBane raised that question. We spoke about the editorial that appeared in the Ottawa Citizen today, which pointed out a number of things. But let me ask you about his charges towards you, that you yourself, because you sit as a director of this company, Extendicare, are in a conflict when it comes to issuing any kind of judgment on the healthcare system, because you would have a vested interest as a director of that company.
Well, first of all, this is a committee report. It's not a single individual report, and it's a unanimous committee report. So if one wants to condemn the report, you have to condemn each of the individual members of the committee, which is exactly the point the Citizen editorial was making. Secondly, when this issue first came up, I guess 2 years ago or something like that, I got asked for a ruling from the ethics commissioner, who said there was absolutely no problem. And the only person who has ever really raised it has been certain critics from the NDP and Michael McBane. In other words, the radical left don't like it because they're frankly very reluctant to debate real ideas. They find character assassination a much better way to
Okay,
proceed.
well, before we go any further with it, though, the ethics counselor doesn't, the guidelines that don't cover the Senate, right? So
No, but I had said up front that I asked him for a ruling, and
yes.
that if he had said there was a problem, I would have resigned as chair of the committee. And he said there's absolutely no problem.
So, I mean, I have the part of the Act here that says, public office holders shall not, outside their official duties, engage in the practice of a profession, actively manage or operate a business or commercial activity, retain or accept directorships or offices in a financial or commercial corporation.
I don't know what act.
But these are the code. This is the guidelines.
I don't know what act, but there is absolutely.
This is off the commissioner's website, actually. This is the.
But the office holders, he's talking about their cabinet ministers. Sorry, the office holders, he's talking about their cabinet ministers.
Okay.
But what I did simply did.
But I mean, that's what conflict is described at, right? So
well, that's a conflict for cabinet ministers. Okay. It's not, and one of the whole debates about the current ethics package is that there are different rules to be applied to MPs and senators, which would be one group, and cabinet ministers.
But wouldn't you be predisposed to doing something that would favor private medicine when you sit on you're a director?
Well, first of all,
of a company that makes money off of private health care, right?
So no, it runs nursing homes. But why is my bias any different than Michael McBane's, whose salary is paid indirectly by a whole bunch of public sector unions, for whom keeping the monopoly that they have with respect to the delivery systems of, with respect to working in public healthcare institutions, why wouldn't they, why is he not subject to the same kind of bias? Why we have a doctor on the committee, I presume the doctor's got to be thrown out because he has a bias, I assume.
But he doesn't have a commercial interest, you do, right? I mean, extended care makes a lot of money.
Well, but wait a minute, I mean, what do you mean doctors don't have commercial interests? Of course doctors have commercial interests. The doctor's a private sector entrepreneur working in the healthcare sector. I mean, Michael McBane has a commercial interest. At least the people that pay his salary have a clear commercial interest, which is the identical position to mine. I mean, the most interesting question to me in all of this is that why has the radical left in this country never been prepared to debate ideas?
You really think there's a radical left in this country?
Well, I think Michael McBane's is pretty well as radical as you can get.
All right, well, this is going to make me sound like that I'm part of it, but I have to ask you this too, because of course what they don't like about the idea of private health care, and this gets into the recommendations of the report as well.
Oh, by the way, our recommendations, so we're clear, our recommendations propose absolutely no change with respect to any piece of federal or provincial legislation respecting the delivery of health care. We do not push private health care. We don't say there's a greater chance of private health care. We simply say we left the status quo the way it was. So why all this sort of
because the content
about private health care is crazy?
But the content of the report, though, that may be the case, but the content of the report actually does go a long way in saying that there isn't anything wrong with having private health care as an option in the health care system. I mean,
can I be clear for a minute?
Sure,
You're talking about private delivery, or are you talking about private funding?
I'm talking about private delivery.
We got to make an absolute distinction here,
private delivery.
Because we're absolutely unanimous on maintaining the same public funding model.
Yes.
Okay.
So private delivery of health care.
Okay.
Okay. There are large parts.
By the way, doctors are, just so we're clear,
yes.
doctors are private entrepreneurs who deliver health care.
Yes.
I mean, we just need to understand. So that's important. And as I say, there has never been any piece of legislation ever, including the Canada Health Act, or any piece of provincial legislation, that has ever said anything or placed any constraints on the structure of who ought to own a healthcare delivery
Let's
institution.
talk about the health.
That's a fact.
The healthcare guarantee. That's one of the things in here. Okay.
Yeah. By the way, he's against the healthcare guarantee. I assume McBane wants people to stay on waiting lists forever.
Okay.
Which is kind of an interesting theory.
Here's his argument about the healthcare guarantee. The argument of the coalition of which he represents. Their argument is that it would be in the interests of that there would be no incentive to make public waiting lists and lineups for health care diminish when there's the opportunity out there for them to go to a private company.
Who is them?
A patient.
Okay, sorry.
And government. There'd be no incentive for anybody to work towards diminishing those lines if there's an alternative that
shows you how unbelievably the radical left, pardon my phrase, have misread the report. What have we said? We have designed a terrific incentive, frankly, for governments to have the existing